because there's a lot of surgeons that'll cut on people, dermatologists that'll do unnecessary biopsies to make a couple $1,000 and mutilate people's skin. It's been on, MSNBC has a show called American Greed. You can go on MSNBC online and watch it, and you can see there's been a couple pharmacists who have been thrown in jail for mutilating people unnecessarily, cutting on them to make a buck. And that's sadly happening across the United States because medicine has been monetized and it's not necessarily prioritized as a national value or right or something we promote. We think wars abroad are more important than taking care of the health of our own people at home or ensuring that they're fed or they have food or clothing or housing. You thank God for welfare and some of these governmental forms of assistance, which I embrace and I applaud, but we could do far better. All of that money, hundreds of billions of dollars being unnecessarily spent on wars that we did not win, that we came out losers in, losing manpower, losing blood, treasure, human lives, other fathers coming home without limbs to their families. It's rather sad. So some of these wars that we fought abroad have really been a deterrent to our well-being at home, and I would encourage the White House and Congress and everybody across this country to focus first and foremost on our own here at home. And I believe public health is #1 priority, and labeling GMOs and our food that we eat. There's terrorists right now on plates and shelves in kitchens and cupboards all throughout America. We're consuming food that's causing us to have cancer. 1 of 3 people in America get cancer of some sort, and diabetes and heart disease, and we're fighting terrorists abroad, but yet we've got far more affecting us on a daily basis when we eat 3 times a day and we fail to look thoroughly at the ingredients and the packaging and the labeling of our food. And we're being lied to, and we need to be more thorough and quick to evaluate and look at the ingredients and in detail, and not just accept spices or natural flavorings or some of these ingredients that are used typically here to cover MSG and cloak and clothe it with another name. So that should not be so, and we need to be more quick and apt to demand the full release of that information, because we as consumers have a right to know what we're eating, what we're consuming, and nobody should be able to withhold that from us. So lift up your voice, make some noise, and let your voice be heard in your local supermarket, in your city, and speak to your department director at your health department, and write a letter to the Surgeon General. Be active in your community, in your country, and be an advocate for public health. And may God bless you as you do.